Key challenges in Newark and Sherwood relate to the fact that we have a very diverse population spread over a very wide geography.
There is a market town and there are a number of quite rural areas and quite isolated areas.
We have the smaller hospital across in Newark, which is delivering some excellent services. We also have the larger hospital across on the other side of the patch in Ashfield, from which most of the acute services are provided.
And there are very different levels of affluence and deprivation across Newark and Sherwood, and trying to meet the needs of all of those people can be very challenging.
I think the fundamental strengths of this organisation is the amount of clinical input that we have, and also the amount of our patients that get involved with the services. When I first started with clinical commissioning some 3 or 4 years ago, there were maybe a handful, less than 5 general practitioners from the local area that were involved in commissioning. Now we've got just under 30 clinicians actively involved on a daily basis with commissioning services for their patients. These clinicians are spread across all of the practices within Newark and Sherwood, and I'm really proud that over the past couple of years we've got all of these people on board to help design services for our local population.
I think the clinical advisor role has enabled us to make sure that we have a good clinical foundation to our design of pathways, or perhaps in some cases arguments that we need to put forward in order to make change. Our GPs are encouraged to be part of work streams, to be involved in all aspects of commissioning. We've even developed a clinical reference group, which are a small group of GPs who we actually contact at the early stages of potential pathway redesign, and this enables us to get an insight into the general feel of how general practice and clinicians would receive these potential changes. I think the great benefit that we've learnt over the last few years is to make sure that everyone realises they're a valued part of the team. Voices are heard. When we have discussions, there's no differentiation between different posts, and everyone has the opportunity to say their bit. And our patients also have a voice, which allows them to feel a real part of service redesign. I love my job. Whilst I'm not directly in contact with patients on a clinical basis as often as I would have done previously, I know that in any form of work with regards to service redesign that I can make a change and a difference to perhaps far more of our population, and feel that we have a great relationship with our patients.
We're looking at all sorts of different angles to improving end-of-life care for our patients. We have a high number of patients here, which is likely to go up a lot within the next 10 years. We're working very hard with other care providers across all sectors to try and improve patient experience and patient pathways. We're linking in with national bodies in order to help us do that, and we hope that the sort of creative approach that we're trying to promote here with integrated team working will rub off on hospitals as well, and that we'll really be able to engage meaningfully with them.
It opens up new avenues of engagement. It also creates an even platform for members of my community to engage with the settled community. And already in this short space of time, we're seeing the community progressing.
If we can communicate our culture and have an understanding of the Gypsy and Traveller community and culture, then we can break down these barriers that we've got in accessing healthcare.
So, of course, the whole community is looking at this as a pathway towards their future, towards a positive future.
The thing that I enjoy most is knowing that someone out there is getting a better understanding because of the training that we have given.
I see by doing what I do, facilitating projects such as this, that then maybe when I've got grandchildren, they're not going to have the same issues with the healthcare as what I've seen throughout my lifetime.
I've educated myself. I the people I meet, and I feel proud to be who I am. I'm proud to be able to mix with the service providers and be able to help my own community.
What I really enjoy about working for Newark and Sherwood CCG is the fact that it's always felt like a very family orientated CCG.
I feel since I've been here I've seen the organisation grow. I feel like I've grown with the organisation, seen a lot of change and a lot of improvement.
And it's a great place to work, yeah, they've been very welcoming and have been really supportive.
We all work together. Whenever someone has a bad day, we sort of all pull rank and try and help out. We couldn't do what we do without working incredibly closely.
You get to understand each other's strengths and weaknesses, so you know what each other's capable of and you help each other out with that, and I think that helps develop the CCG. If I have any suggestions or any important ideas to make, I feel that they are recognised and listened to and often acted upon.
I think I've been allowed to develop as an individual, and whatever I say has always been considered.
It gives you a lot of job satisfaction really, and makes you think that what you do is still worthwhile. Although I'm not directly working with patients anymore, that I still can improve care for them.
It feels really good to have been part of this commissioning group and knowing that we're changing people's lives for the better, the patients out there, and I just hope that this will continue into the future.
Our main aims and goals for the next few years are to make sure that we improve the health of the people within Newark and Sherwood. We want people to live longer lives in a better environment with more joined up care with high quality service provision.
We want people to be proud of their local NHS, that's our key aim, and we want people to be treated with respect and dignity in the services locally.
Newark and Sherwood Clinical Commissioning Group have some very ambitious plans for the future and how to deliver healthcare for our local population. I feel proud to be part of Newark and Sherwood Clinical Commissioning Group, and I'm absolutely sure that over the years to come we can deliver services to our patients that not only they're proud of, but also us as an organisation are proud of as well.